good afternoon, everybody. Thank you for joining us here today. And we're here at Metro Public Health and Wellness to celebrate that both the Pfizer and the Moderna vaccines are here in our city. Can I hear an amen? Yes, yeah. So finally, look, there's a lot of work still to be done, but we can see a light at the end of the tunnel here. And we've been making our way fighting this dastardly virus, COVID-19 virus, for quite some time. So it's just good to have some good news. There's a long way to go, as I said. Dr. Moyer and I and many others are getting a first dose today, along with some of our healthcare heroes, because we want to model that this vaccine is safe and it can be trusted. We're obviously taking it to demonstrate that, and we recommend that people, when your number is called in the community and your family's number as well, to be ready, because it's going to take all of us to get vaccinated to make sure we defeat the virus. Now, there'll be a lot of time between now and then for some folks, so there'll be a lot of communication and education between now and then. But we've got to all do our part, and that's how we will defeat this virus. As we discussed at last week's briefing, Metro government has launched a vaccine distribution task force and a vaccine communications task force as well. And their goals are to plan widespread distribution that's efficient and equitable, and to ensure that we've got the right messengers with the right message at the right time to build trust in the vaccine and the people and the processes behind it. Now, we've got to also know that we've got to hunker down here for a little while. While we started the vaccines, 9 days ago, this is going to be going on for months, well into New Year, in the spring, probably the summertime as well. So we've got to replicate what we did over these past couple weeks when we were in reduced movement mode. People were staying at home. The restaurants and bars were closed. And what you saw at schools were closed. What you saw is the numbers have come down, and we've plateaued. It's a high plateau, but we plateaued. The numbers quit going up like a hockey stick. So we know these measures work. And so we just really want to emphasize during this holiday season, the Christmas and New Year season, please, everybody have the same level of diligence that you had during Thanksgiving. No big gatherings. When you're inside with people that are not in your bubble, keep your mask on inside as well, because while we plateaued, the numbers could just as easily skyrocket. And obviously we don't want that, especially with the light we have here at the end of the tunnel. So before we get more into the vaccines here, we're going to hear from our Chief Health Strategist, Dr. Sarah Moyer. So, Doc, we're at a real transitional moment right now in our fight against the virus, and we've got the first doses of the vaccine, which is really good, obviously, but the virus is still infecting more people than ever. So what's the latest on COVID-19? This is part of our weekly where you go through the data.
Went up 2,715 new cases over the previous week. So our upward trend, as the mayor said, has started to decrease, which is really encouraging, and hoping that people keep that same diligence that they did over the last 2 weeks. Last month, really, as we go into the holiday season, so that trend keeps going down as we have hope with the vaccine coming up. For hospitalization data, 18.9% of patients currently hospitalized are there for COVID-19. There's 83 patients in the ICU and 59 patients on ventilators. We're still seeing COVID-19 in every zip code across the county, and every zip code is in red. So please keep up that great diligence in wearing your mask if you are going out, keeping that 6 feet away, and don't expand your bubble for the holiday season here coming up. Our largest increase of cases is still in our 20 to 44-year-olds, and majority of the new cases are also still in our white population. So that's it for the data. Back to you, Mayor.
Thank you. So if you just give some advice to people in the viewing range here. We've got Christmas, New Year's coming up. What advice do you give folks here so we can keep this virus in check?
Spend the holidays with the same people you've been hanging out with for the last month. If that is not possible, please make sure, start quarantine now. Ideally, you would have started quarantine 14 days before, but get tested before you hang out with other people outside your immediate family. So if that's today, I believe we still have some spots open tomorrow. Encourage everyone to get tested before you hang out with others. And then when you get back, if you do travel or you do hang out with others, please get tested 3 to 5 days after you return, and try to quarantine for at least 7 days, ideally 14 days when you get back, following the state recommendations of any travel outside of Kentucky. Be especially careful with Indiana and Tennessee. Those are two of the top counties for COVID spread right now. So we are surrounded by a lot of coronavirus. So please stay safe at home and have a very Merry Christmas and a very Happy New Year.
So more and more people are getting their vaccines. We're going to get one today. Does that mean that we can throw our mask away and that we can just gallivant around the town? And for anybody that's got the vaccine, is that the new normal, or is this just a stop along the journey?
We are not there yet, so please keep wearing your mask, stay 6 feet apart, stay home as much as possible. It's okay to go outside and exercise and hang out in your neighborhood, but just not expanding that bubble. Do as much shopping online, take out at your favorite restaurants. All those things are really important, especially for the holidays. We do not want any more family members to get sick than need to over these next couple weeks.
I'd like to introduce our interim medical director, Dr. Sarah Beth Hartledge. Doc, can you talk about where we are with the vaccine in the city and how much we have, who it's going to? What's the latest?
Sure. Thank you, Mayor. We received our first shipment just this morning. It is the Moderna vaccine, and we received 3,000 doses. Those doses are all allocated for Tier 1A individuals, which are primarily healthcare workers. That does include our first responder healthcare workers, such as EMTs and paramedics, and we'll be seeing some of those folks today. We're expecting to see further shipments in January and hopefully on a regular basis thereafter. We'll be vaccinating some of our first responders and healthcare workers who don't happen to work for one of our big 3 hospital systems, Norton Baptist or University of Louisville. So all those other healthcare workers out there in the metro. It is important to remember that the Moderna vaccine is a 2-shot series just like Pfizer, but this one has an interval of 28 days, so you get about a month between your first and your second shot as opposed to 3 weeks with the Pfizer vaccine. So a little bit of a difference in the administration, but both products are very efficacious, and we're excited to have the ability to start getting it out into our community here locally.
Thanks. So one of the purposes of the Vaccine Task Force and the Vaccine Communications Task Force is to inform the public of really what's taking place with the vaccines, where they're going to be administered, how, make sure it's done in an equitable way. But it's quite the logistical challenge, Doc. So you want to talk about, so for instance, we're starting now. The vaccinations will be continuing on for, let's say, at least 6 months or so. But then we have the second wave when you have to go back for your dose. So if it's the Pfizer wave, it's 21 days. If it's the Moderna wave, it's 28 days. And then we are going to have new people getting vaccinated as well. And then we will be continuing our testing in the community at the same time. So can you talk about some of the logistical challenges associated with that?
The second shot does present a logistical challenge because once we get into week 4 and beyond, we have kind of double the number of people, because everyone who came through in week 1 has to come back through in week 5. Plus a whole batch of new people who are getting their first shot as well. We will be continuing testing because just like Dr. Moyer said, we're not at a point where we can let go of any of the restrictions or things that we're doing now to help protect our community. So we are starting vaccination here today with a bit of a cross-section of our healthcare worker population. And then we will be continuing over the next couple weeks with some first responders and other healthcare providers, and looking to set up a large-scale vaccination program to go live in January.
And so we're doing some of our city EMTs, for example, but then will they be going to hospitals as well and getting vaccinations elsewhere?
Yes, so we are partnering with University of Louisville Hospital to help us get some of our EMTs vaccinated over the next week or so before the end of the calendar year. So we have about 250 EMTs or paramedics who will be going through that process in a partnership with the health department and University Hospital.
And then how were the people that are getting vaccinated today selected?
reached out to our emergency services colleagues to help select a cross-section of their EMT and paramedic populations. We also have healthcare workers here who represent folks who work for the health department, and then we have some from our federally qualified health centers, Park Duval, Family Health Centers, and Shawnee Christian, all of which help serve an important role in our community for our underserved populations as well. So we have one representative from each of those three groups as well. We have 13 EMTs here. We have 4 physicians and 3 other healthcare providers as well.
And I think Dr. Moyer is going to be our first recipient of the vaccine, right?
Yeah, that's correct. So I'd like to introduce our nurses who are helping give the vaccines today. I have Chrissy Hazlip, and she is our nurse administrator here at the health department. And then I have Jamie Royal, who is an outreach nurse with our tuberculosis clinic.
Well, I understand we have somebody visiting from the North Pole. There we go.
Merry Christmas.
Santa Claus, St. Nicholas.
How are you?
Thanks for visiting our city at this important time.
You're welcome. Thank you for having me.
Well, I hope Mrs. Claus knows you're here.
Who wants to do the honor?
So if this is safe enough for Santa Claus and Dr. Moyer, it's safe enough for anybody.
As she's going over my paperwork, I actually put some thoughts together because feeling really excited right now, really almost to the point of tears, because today is the 286th day that my staff's officially been battling the pandemic. But really, it's almost a year for us because we started tracking data and monitoring the situation out of China last December. But we've not only been battling the pandemic, we've been battling for the community. We've worked hard to find innovative solutions to ensure that our clients get the services that they need to stay healthy and safe. And whether it was transitioning our WIC clinic to phone-based appointments so families can have the food that they need, ensuring continuity of operations, safety for our syringe exchange clients, particularly making sure they feel connected and know that we care for their well-being because they already feel disconnected and isolated, and that's been heightened during this pandemic. We've also continued to safely operate our TB and sexual health clinic because we want to prevent other disease outbreaks. A pandemic is enough to handle at once, so very grateful to those staff as well. And we've been battling for equity. We know that our Black and brown residents have suffered a higher burden of disease and death from the pandemic. So we've worked hard to make sure that testing is convenient and available to everyone in our community, making sure, yep, I'm going to keep talking so I don't know what's going on. Really so much more I can say, but the bottom line is that we're all battle weary, and my team, everyone, and I'm going to,
Well, I'd say he's a
that was
little,
nothing.
little sleep weary too. So
Yeah.
folks here at Public Health have pulled together in a magnificent way.
Very simple.
Didn't even feel it, huh?
No.
No, it barely got a hold. There you go.
Congratulations. There we go. There's-
It's the best Christmas present ever, so thank you.
Good job, Doc. So a big thanks here to all of our public health team, our EMT, paramedics, all of our first responders. All right, Santa Claus, you're the star of the show here, buddy. All right, Santa, there you go. Give our best to Mrs. Claus.
You know, just to be clear, this is a 2-dose vaccine. And as you may have heard, Dr. Fauci actually visited me in the North Pole a few weeks ago and gave me the first dose. He checked my immunity and I had an immune response, but he strongly recommended that I get the second dose prior to making my rounds. And the Louisville Public Health Department was good enough to offer to give me that second dose. So I really appreciate that so I can make my rounds tomorrow night without work.
Thank you, Santa.
Yeah.